I'm Professor Malcom Richardson, and I'm the director of the Mycology Reference Centre here in Manchester, which is an NHS fungal diagnostic centre. And I've just been chairing a session, the last session of this meeting, really just looking into the future, various directions that have been explored for both treating and diagnosing diseases caused by aspergillosis. So the first talk in this session was really addressing the issue of, are there any new drugs against aspergillus in the antifungal pipeline? So the first talk was by Dimitris Kontianis from the MD Anderson Cancer Center in Houston, Texas, and he went through a number of experimental compounds that have been explored. He gave a very nice outline on his talk, which really discussed about reformatting, repackaging old drugs, but also some new compounds, because we still don't have the perfect drug. We have drugs which are toxic, drugs which may or may not lead to resistance, and of course there's always the issue of cost. So he took us through a number of new compounds, some of which did not have a name yet, others did, working on various new targets that have been recognized that potentially might be targets for killing Aspergillus fumigatus. And then the second talk was on Aspergillus vaccine specifically, and this was given by Stuart Levitz from the University of Massachusetts Medical School in the United States. And he took us through a number of vaccines that have been explored over the years, and some new work that's going on. He outlined the obstacles and the caveats that are associated with vaccine development, not just applied to Aspergillus, but to other organisms as well, and really making the point that millions of people would benefit if we had good vaccines against aspergillosis. He reviewed some of the older literature, but really did highlight the challenges in vaccine development. There are the logistical challenges, and there's of course getting access to patients in developing countries. That was a very good point that he made. So then he went through the various approaches, and these were pan-fungal vaccines. These were vaccines which would be constituted of whole organisms, crude vaccines, and recombinant vaccines, highly specific compounds and fractions of Aspergillus fumigatus. One of the future challenges that he recognized was the choice of the adjuvant, very important in vaccine development. Adjuvants needed to stimulate the immune response in patients. And then also there was a discussion about the immunotherapeutic approach, especially in patients who have undergone or are about to face an allogeneic transplant. And that was a very interesting part of his talk. And then looking into the future, looking into his crystal ball, he really made the point there are vaccines worthy of study, worthy of investment and taking forward. And so that was the second talk in this session. And then finally, Professor Denning from Manchester, from the National Aspergillosis Centre and the University of Manchester, developed a number of what he called thought experiments, how the implementation and how the development of good fungal diagnostic tests could reduce the levels of antibiotics that are given to a variety of patients. Antibiotics which are known to confer drug resistance in a number of bacteria. So his thought experiments sort of leapt from various work streams and the impact of fungal diagnostics on the antimicrobial resistance agenda, citing examples of pneumocystis pneumonia in patients in the setting of HIV, a setting of chronic pulmonary aspergillosis, where we have patients, over 1 million cases of smear positive and negative tuberculosis who may be treated inappropriately for tuberculosis because fungal diagnostics are not available, and we know increasingly now that a significant proportion of these patients do actually have a chronic fungal disease, chronic pulmonary aspergillosis. And then he mentioned Aspergillus bronchitis and the inappropriate use of antibiotics for treating bronchitis where it's not really known or recognized that Aspergillus may be the cause of bronchitis in a large number of patients. He also talked about patients with COPD, again treated for a bacterial infection in association with that, not really understanding the fact that these patients might have a fungal infection. So with better diagnostics, simply being able to detect Aspergillus IgG in these patients would then focus and tailor the treatment to a fungal infection, not a bacterial one. And making the case that over 3 million cases of COPD in China, for example, who are unnecessarily prescribed antibiotics. And then Professor Denning finished off by stepping sideways slightly and using the Candida field as a good example of where we do appear to have better diagnostics, some new platforms, some new techniques, not all available yet, just really making the point and concluding his talk that with better diagnostics there we could stop treating patients with sepsis inappropriately with antibiotics when in fact they do actually have a fungal infection caused by, in this particular case, by Candida. So he summarized his talk by saying basically the use of good fungal diagnostics will reduce the use of antibiotics and hence reduce the amount of antibiotic resistance in bacteria.